Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Leukemia is a type of cancer that affects the blood and bone marrow, which is where blood cells are produced. In leukemia, the bone marrow produces an excessive number of abnormal white blood cells, which crowd out normal blood cells. These abnormal cells can't fight infections like healthy white blood cells, and they prevent the body from producing enough red blood cells and platelets. This disrupts the body's ability to fight infections, carry oxygen, and control bleeding. Raising awareness about leukemia is crucial because early detection and treatment significantly improve outcomes. Leukemia occurs when our bone marrow, the body's blood cell factory, starts producing abnormal white blood cells. These abnormal cells, called leukemia cells, crowd out healthy blood cells, disrupting the body's ability to fight infections, carry oxygen, and control bleeding. There are several types of leukemia, broadly classified as acute or chronic. Acute leukemia progresses rapidly, requiring immediate treatment, while chronic leukemia develops slowly, often with milder initial symptoms. It is further categorized by the type of white blood cell affected. Acute lymphocytic leukemia, ALL, is a type that progresses rapidly and is more common in children. Acute myeloid leukemia, AML, is another fast-growing type, often seen in adults. Chronic lymphocytic leukemia, CLL, progresses slowly and mainly affects adults. Chronic myeloid leukemia, CML, is a slower growing form, but can speed up over time. While the exact cause isn't always known, some factors can increase your risk: genetic mutations or changes in the DNA of blood cells. People with certain genetic disorders, like Down syndrome, have a higher risk of developing leukemia. Exposure to high levels of radiation or certain chemicals, like benzene, and previous chemotherapy or radiation therapy for other cancers are some known risk factors. Family history of leukemia or other blood disorders. Smoking can increase the risk of developing certain types of leukemia. It's important to note that not everyone with these risk factors will develop leukemia, but they can increase the likelihood. However, it's important to note that having a risk factor doesn't guarantee you'll get leukemia. It simply increases the chances. Leukemia often presents with a range of symptoms, which can be subtle and easily mistaken for other common illnesses. Fatigue, weakness, and shortness of breath are common due to the lack of healthy red blood cells to carry oxygen. Frequent infections, fever, and chills can occur due to a shortage of healthy white blood cells to fight off invaders. Easy bruising or bleeding, pale skin, and bone or joint pain are other red flags to watch out for. Diagnosing leukemia typically involves a combination of physical examinations, blood tests, and bone marrow biopsies. It typically starts with a blood test to check for abnormal blood cell counts. If leukemia is suspected, doctors may also perform a bone marrow biopsy, where a small sample of bone marrow is taken to look for cancer cells. Imaging tests like CT scans or X-rays may also be used to determine the spread of the disease. Treatment options vary depending on the type and stage of leukemia, as well as the patient's overall health and preferences. Chemotherapy remains a cornerstone of leukemia treatment and uses drugs to kill cancer cells in the blood. Targeted therapy involves drugs that target specific cancer cells without harming normal cells. Radiation therapy uses high-energy rays to kill leukemia cells or stop them from growing. Bone marrow transplant replaces damaged bone marrow with healthy stem cells, either from the patient or a donor. Treatment can be long and challenging, but many people go on to live full, healthy lives after leukemia treatment. Patients can benefit from support groups, counseling, and staying connected with loved ones. If you found this video helpful, give it a thumbs up and don't forget to subscribe, like and share for more health tips.